I'm Dr. Jon LaPook, medical correspondent for the CBS Evening News with Katie Couric, and Dr. Jennifer Ashton is with me, who is our medical correspondent for the early show, as well as Dr. Peter Gross, who is an expert in infectious diseases. We're trying to get some reality checking in here. Today we heard all sorts of news. Nearly 2,000 cases of swine flu have been reported in Mexico. You heard from Katie, at least 149 deaths. And here in the United States, at least 40 cases. We're hearing about spread of this, and the WHO raised the pandemic level from level 3 to level 4. What does this mean? I'm an internist and gastroenterologist. I've been getting all sorts of phone calls today from worried patients, and we all remember what happened 3 years ago with the bird flu and in 2001 with anthrax. People tend to freak out. And the question is, you want people to be calm. You don't want people to be unduly panicked. On the other hand, we are at a heightened state of alert. The officials are telling us that there is a problem going on. So I think one of the things we want to do today is to try to give people some sort of sense of how serious is this. You know, in the United States, there haven't been any deaths yet. The cases have been relatively mild, but in Mexico, we're hearing that there are all sorts of problems and deaths, right? So, Dr. Gross, I'm going to toss that to you. How worried should we be?
I think it's too early to be 100% sure, but I have to tell you, I'm a little bit concerned, but I'm not overly concerned because no one's died in the United States. People have died in Mexico. The vaccine that we've been using in the United States for years may in fact offer some protection. We need to find out more about that.
All right, that's one of the big questions that's come up is people seem to be doing relatively well here, and yet in Mexico they're dying. And in Mexico, generally 36,000 people die from the regular flu every year. They tend to be people over the age of elderly or people with medical problems or very young. And yet in Mexico it was young adults. What's going on in Mexico that this should affect young adults?
In 1918, young adults were a major target group, certainly more than the elderly. So young adults tend not to be vaccinated. That may be part of it.
So that what happens then when they get infected? It tends to be.
It can be severe. Now this is not just a mild case of the flu. This is more than your average flu. That's why there's so much concern.
Okay, but there's also something theoretical that goes on, right? People talk about, normally when a normal person gets the flu, the immune system takes care of it, right? And the virus itself is taken care of. But in people who have a very bad reaction to the flu and die, their immune system somehow gets overly stimulated and really revved up, and it's the immune system that's actually harming the lungs, right? You want to explain that?
They actually reconstructed the 1918 swine flu virus. And they found in animals, yes, it causes an excessive immune response that can overwhelm the lungs in a short period of time and result in death.
All right.
And
so,
then, of course, also, John, the other thing that I think is well known to happen, especially in young people, especially when you're talking about children, but in adults as well, is the virus kind of comes in first, and then you get a second wave of bacterial, what we call superinfection, and that can become really a setup and deadly in a lot of cases.
And could that be one of the problems in Mexico, that you have the initial, first of all, there's a lot of things we don't know about what's going on in Mexico, right? But you have the viral infection, it damages the lungs, and then you get the bacteria that come in secondarily. So at that point, antibiotics can help, right? As opposed to the anti-flu medicines, Tamiflu and Relenza, which can help if taken within 48 hours of symptoms when you get the virus. So bacteria can be treated by regular antibiotics, and also, if you're treated in a hospital that has breathing machines and advanced ICU, intensive care unit techniques, your survival may be better. So is there a possibility that in Mexico they're just not getting the kind of treatment they would see in the United States?
Entirely possible, and all of the things that you mentioned, John, are what were not available in 1918. Right. They didn't have antiviral drugs. Two of the antiviral drugs we have today are actually quite effective against this virus. If someone gets a viral infection and then gets a superimposed bacterial infection, they didn't have antibiotics, we do, and we have the respirators that can take care of patients. So it's
So it's a different- it's a
intensive care
different
is
world.
totally different.
And again, to reiterate, the way people, because people have been asking me this, how do you die from this, okay? There are two
Right.
ways that you die from it. One is your lungs fill up with fluid from this big immune system response. It's you get leaky lungs, the lungs fill with water, and you can't breathe. You literally suffocate, okay? And the other thing that happens is that if you have an underlying medical problem, right, that can tip you over. So if you have somebody with heart disease, if you have somebody with lung disease, and they get this flu, it can tip them over, right?
Right.
A lot of the questions out here are about Tamiflu. So Jennifer, you want to take that?
Well, some Tamiflu, interesting Tamiflu facts, John and Peter, that we've been really kind of becoming re-familiar with all day today. The national stockpile consists of doses of Tamiflu for approximately 25% or 1/4 of the U.S. population. It is an antiviral medication that luckily appears to be very effective against this particular strain of swine flu, as is the other medication, Relenza. And if given in the first 24 to 48 hours, can really shorten the symptoms, as the duration of symptoms, as well as the severity. Now, how people are getting Tamiflu is a question, because again, people are starting to panic, which we do not want. Ideal usage of Tamiflu is really on advice of a physician. So first you want to be diagnosed with this strain of influenza or influenza A, the run-of-the-mill influenza, before you start taking this medication. This is not indicated for anyone who feels a cold coming on. I think that's really important.
I totally agree. And in fact, today, in New York City, I called a bunch of pharmacies, and they all told me there's been a run on Tamiflu. And I called the CDC and the New York City Department of Health. They both confirm you should not be giving, doctors out there, you should not be giving Tamiflu because we're being pressured by our patients. I want to have some just in case. I want to have it, who knows, there'll be a run. Well, it's a self-fulfilling prophecy.
Right.
You're afraid there's going to be a run on Tamiflu, so you stock up, and then there is a run. And there are two problems with that, right? One is, people take the Tamiflu and they've got it, and they tend to take it inappropriately, right? So suddenly you have 102 fever, and from your urinary tract infection,
That's right.
You're taking Tamiflu, and that can lead to resistance. Right now, the bugs are sensitive to Tamiflu and Relenza, and the last thing we want to do is be misusing and overusing Tamiflu and Relenza and cause
That's
resistance.
right. And missing those patients who are sick from other things, because as you said, we do have to remember other things can give us a flu and
Right.
cough and nausea, vomiting, and diarrhea.
I had a patient with strep throat this morning who it turned out to be strep throat, and nothing.
Same, another one.
Nothing dramatic. And the other thing is that, again, everybody wants to protect. It's so human, right? You want to protect my family. I know there's a problem. I know I don't want
Right.
but for my family, I want it, okay? But the problem there is that there's plenty of doses around. There's 50 million
That's right.
doses, all right? There's plenty for everybody, unless we start making a run on it. And
That's
then what's
right.
going to happen is there's not going to be enough of the Tamiflu for people
When we
who
need it.
really need it. Not just people who have swine flu, but 36,000 people a year die of regular
Regular
flu. We're at the
influenza.
tail end of the flu season, but people still can get it and die. And we say 36,000 a year. That's a lot of people
I have
compared
a
to how many
question
died
for
of swine flu.
Peter. This particular strain of swine flu, luckily, as we said, is sensitive to Relenza and Tamiflu, but resistant to the other two antiviral medications. What do you make of that? And is this something that you will be more concerned with as an infectious disease specialist, that when we see this swine flu again, that it might now become resistant to things like Tamiflu and Relenza?
Well, the two that the bug is not susceptible to really are very old antiviral drugs that don't work too much anymore. And Tamiflu and Relenza work by entirely different mechanism of action, and they're still very effective against the swine flu. And they've been very effective against this group of viruses, the H1N1s, for years.
Now, one of the from the CDC, they have some preliminary germ tracking information on this virus, if you will, and they've found that actually there are 4 components to it, 4 basic genetic components that really come from bird flu, swine flu, and human influenza, but 2 different locations of swine flu. How smart is this virus, and do you think it's going to continue to evolve?
Well, influenza virus always outsmarts us. Here we had avian flu, and we figured, well, that's new, it's an H5N1, it's going to be a problem. Humans have never been infected with it. It's going to be bad. But the reality was that particular virus was found in China in 1993. So we're talking about 16 years, and it hasn't caused the pandemic. It's not going to cause a pandemic unless it mutates in a major way, and it hasn't done that in all these years. And what happens? In Mexico, of all places, swine flu pops up out of nowhere. And this is the unpredictability of flu. So when it happens, we have to address it, as we're doing.
And we are getting questions from our viewers about mutations. In addition to the Tamiflu questions, what are the likelihood that it's going to mutate? This past season, we should say that by the end of the flu season, almost all of the flu was resistant, like 98% was resistant to Tamiflu. So one of the questions is, maybe we're fine now. We're a little bit lucky because it's the warm weather, right? So it's not great breeding conditions for the flu. But typically in flu epidemics, right, you have an 8 to 12 week waves of the disease, and then you can have a couple of months off, and then you have another wave.
Right.
So what do we have to look forward to? I mean, is it going to be in the fall or in the next flu season? Is it going to hit us? And by the way, can you have a recombination of last year's flu, which was resistant to Tamiflu, with this year's swine flu? Can that happen?
Flu can recombine. That's it's one of the few viruses that is made up of multiple pieces genetically, and that can recombine. As far as Tamiflu resistance, the resistance was seen with I hate to be too technical, but with the H3N2 viruses, not with the H1N1s.
Right.
And this is an H1N1. So it's still susceptible. And it's a great drug, but if you take it, you have to take it within 48 hours at most. And most areas of the country have not seen swine flu. So any use of that drug really needs to be targeted to the areas where there are clusters.
And is the use, if you give Tamiflu, like when the health officials run to an area where there's an epidemic or where there was an outbreak, and they're giving everybody Tamiflu, is that actually helping it to spread? I mean, is that actually protecting somebody 1,000 miles away or 500 miles away? Can you contain these outbreaks?
I don't think anybody's really shown that you can. We don't really have enough information about that. What we do know, in 1976 at Fort Dix, there was a swine flu outbreak. It was devastating at Fort Dix.
Right.
But when those soldiers went home, they didn't spread the virus at home. So it showed that while it was devastating in a military setting, in a civilian setting, it was hard to spread patient to patient.
And we should mention the 1976 outbreak at Fort Dix. There were several hundred people, soldiers, who didn't have symptoms, who when they tested, they found out that they had been exposed. So we may just be seeing the tip of the iceberg here. I mean, how much, I spoke to the New York City Department of Health, and they really, I have to say, they are all over this. They are testing people, they're out ahead of it. They're finding the first cases here, maybe because they're more aggressive than in other parts of the country.
And increased surveillance.
Increased surveillance, and I mean, I've been talking to them for years, and I've been very impressed with how organized their effort is. And so is it possible that, the reason why the outbreak is starting in Queens, because, they tested, and if we really test, once we start testing all over the country, we're going to see a lot more. Do we expect to see the numbers go up?
I think I would expect to see the numbers go up, but usually when flu occurs, it occurs in a cluster in this setting, and something fishy's going on, something different's going on, and you need to call in a state health department or a virus lab to culture for this.
All right, so let's get down to some nitty-gritty. Okay, first of all, symptoms of the flu. Let's just get it out there, right?
Let's go head to toe.
Head to toe. So, fever, aches and pains, cough, headache. You can have a runny nose, and sore throat, and then you can also have GI symptoms, nausea, vomiting, and diarrhea, okay?
And I think the thing that's most striking when you speak to patients like we've all had who have had influenza, not the swine influenza, but just regular, tested, proven influenza, is they say, this is beyond the cold.
They feel loud.
You feel like you want to die. I mean, it is severe symptoms. This is not something where most people are still going to work and saying, well, I just don't feel my best today. It's severe, it's not subtle.
And I'm sorry, the phone call I got this morning about this person turned out to have the cold. I mean, in general, the cold's from the neck up, right? And it's generally you're not feeling like a ton of bricks at you.
And fever is pretty unusual with most colds. With the flu, it's much more common. And severe body aches, as you mentioned, Jen, are really something very unusual for a cold.
And I'm getting a question, how long are you contagious for?
You can be contagious for up to a week.
And
Children
for kids
sometimes
a
Kids
little
even
bit
a little longer,
And
right.
the incubation period takes about 3 to 5 days.
Right.
Right.
Now, you talked about kids, John, and I have school-age children, 3rd and 5th grade, and actually the school did put out a blast email today about swine flu, urging parents again, and this is common sense precautionary measures for any illness. If your child is sick, don't send them to school.
Right.
They have a greater likelihood of infecting others. So I happened to say to the school nurse, I hope you have hand sanitizers in every room. And she said, don't worry, the kids wash their hands. And I think, again, even as adults, when you walk into a bathroom, you might wash your hands correctly with hot water, soap, 60 seconds. But when you touch the faucet again, that faucet is still potentially
And that's
contaminated.
part of the dance you see people doing when they're leaving the bathroom.
That's right.
So wash your hands, common sense thing. Sneeze into a handkerchief.
That's
not a
right, or
handkerchief,
your arm.
Into a tissue, and then throw the tissue away.
And then wash your hands.
And then wash your hands. I mean,
Right.
it's spread through respiratory droplets,
Right.
right? And what happens is just, use your common sense.
And then you touch your face.
You sneeze into your hand, and then it's on your hand. You touch somebody, that person touches. And I have to say, what kills me? The New York, I live in New York City. Okay, it's a cab driver, right? And you say, I want $3 change. And he takes out the wad of dollars and he goes, right?
Well, how
And he
about
licks it.
these?
And I'm thinking, why don't you just lick my face? I mean, why lick your hand and then put the spit on the dollar, give me the dollar, have me touch it, get the spit on my hand,
Right.
and then have me accidentally touch
And
my.
we know that
just get it over with. Lick my face.
Cell phones, Blackberries, computer pads. But
So here's advice for you cab riders. If somebody licks their hand to give you a dollar bill back,
Don't take it.
Say keep the change. Okay, that's my advice. That's the big tip for today.
what do you both
now-
think about the masks, since we're on the subject of
Okay.
face?
The masks help prevent what's called droplets for spreading, so it's certainly worthwhile if you have a bad cold.
Right.
But one of the key things that is being emphasized much more now than it was in past flu epidemics is this social distancing.
Right.
Stay at home if you
Yeah.
have a bad cold. Please, you're jeopardizing other people. Stay at home.
Now, a couple of questions are coming there. They're piling up, so this is great.
Oh, that's
People
great.
Thank you. You're out there. You're listening. There's 1,000,001 questions. Testing. How are you tested for it? What do you do? And who should be tested?
I think anybody that has a bad cold that thinks it's the flu, or if they have a cold and they're in an area where there's a known cluster.
Where there's a or they're high risk. I'm going to
or
interrupt
they're
you for
high
1
risk.
second
Yeah.
because you probably don't have this, but I got from the New York City Department of Health yesterday an advisory saying that if you're home, which I did not know, if you have a patient call you and they're suspected, they think they have the flu, but it's mild, they normally would just stay home. They wouldn't go to the hospital. Do not bring them into
Right.
your into your
Interesting.
office. Do not test them because just the process of bringing them in is going to spread it.
Right.
But if you start to get really sick, if you have trouble breathing, if you're
Sure.
turning blue, any of that stuff, if you get well and then you get sick again,
Right.
then obviously call your doctor. I think what's really important are two things. One is talk to your doctor. You do not want to be making these decisions yourself. You have to assess this. Everything's on an individual basis, right? And two, for the doctors out there, get hooked up for with your local Department of Health email system, the blast system, because I would not have known this. And this is, this is a fluid system, and it's something I want to bring up, which is that we as doctors, we're used to just calling the shots, right? We do things our own way, and we want to run it. But you know what? This is not the time to be a
No.
rogue physician.
Nope.
You want to be following the advice of the Department of Health. They've thought about it. We're thinking about this for several days. They've been thinking about this for years. And
That's right.
it's so crucial because logically I would have said, oh, come in, I'll test you. But you know what? They've thought about it. They're experts.
That's
Say,
right.
no, stay at home in this case. But because this is a fluid situation, because the recommendations are changing, you really have to be in touch with your doctor, who's in touch with the Department of Health, and to figure out what to do. Now, what about cleaning around the house? You have a question. How do you clean around the house properly in terms of disinfecting or in schools, or how do you do that?
Just do whatever you've been doing. The main thing is human-to-human spread. If you shake somebody's hand, wash your hands. Don't touch your eyes or other parts of your face. Those are all important.
All right.
What about the hand sanitizers? You think those? I'm a big fan of those. I
The-
think they're easy to travel with, and
The hands, soap and water, or the alcohol-based
These-
hand sanitizers definitely work. The virus is very easy to kill.
Right.
Very easy.
Now, I got a question about travel plans. Should I go to Mexico? Well, they put an advisory out saying look,
don't do it.
Don't do it unless, unless whatever,
Yeah.
unless you
Well, I
have to.
think, John, on the email that you had forwarded to me earlier today with those advisory precautions from the Department of Health here in New York, there was another interesting point which said that if you are in Mexico and you do not have to travel home, don't get on a plane. If possible, drive. And I think that's a really good point because obviously you're on a plane. If you're sitting next to someone who's coughing and sneezing, or you're on a flight for 4 to 5 hours, your chances of becoming exposed are greater.
I just wanted to say that it was not from the Department of Health, just to it was from my friend Dr. Tom Nash, who's a great infectious disease doctor and a pulmonologist, triple boarded internal medicine, lung, and infectious disease, a commercial for Tom Nash. But he really gave it a lot of thought and said, you know what, maybe you should drive back, rather than being on a plane. But now, here we're telling people some mixed messages, right? So we can whip ourselves up, right? We're telling people, don't take Tamiflu if you're sick. In fact, maybe you should take a chill pill, right? On the other hand, we're hearing, maybe there's going to be a pandemic.
Don't get on a plane.
Don't get on a plane and all this. So I think people hear the mixed messages, right? And they say, calm down, but maybe you should be a little bit, excited about this. So what's the person at home supposed to do?
Here's the way I think about it, and both of you tell me how you think about it. I always put it into a fraction. I take it back to high school or simple math or science. Put it into a fraction. What do we have in the top of the fraction? In the numerator, right now we have 28, 29 cases in New York, correct? So, we're well under 100 in the U.S. at this point. There are 300 million Americans. If you divide out that fraction, that statistically we are safe and we have 0 deaths. So I think that is very important. I don't know how.
If you are in an area where there's a cluster, and you have severe body aches and a fever, call your doctor and get a prescription for Tamiflu. Don't just run out and buy it in case. Otherwise, we'll exhaust the supply.
That's right.
And they may not even give you the Tamiflu. I mean, that's on an individual,
it's up to them.
Individual basis. Now, media hysteria. Question about media hysteria. Are we all whipping it up? So we were ahead of that question. I have to say this. 3 years ago, at the height of the bird flu epidemic, I wrote an article called "Bird Flu Over the Cuckoo's Nest." And it started out something like, with the SARS and the swine flu and the anthrax, I find myself wistfully longing for the time when I was 10 years old, and the only thing I had to worry about was total nuclear annihilation, right? And, we're kind of, and I was sort of saying, we need to be calm and we need to think correctly. So for the people out there who are wondering whether we're whipping this up into something that's worse than it is, I think our goal is to try to help everybody out there think correctly. So we don't want to be a Pollyanna says everything's fine, but on the other hand, there's no percentage here. There's no points. There's no money for us in guessing correctly. So it's not like calling the election.
That's right.
CBS has called the pandemic level 5.
Right.
20 minutes before any other network. So our job is to report what's going on now. To think correctly, right, and to have experts like you say, well, how do you put that in perspective?
We don't have enough information to be really worried or not worried at all. So I think the way things are proceeding, raising the level to 4 from 3, that's just reality. There are small clusters, so we do that, and it makes more things available to deal with it. I think it makes a lot of sense.
And by the way, I should say that one of the, we declared a health emergency yesterday. Well, part of the reason for that was just a technical reason, logistically, that allowed them to release the 12.5 million doses. It was sort of like preparing, as they said, preparing for a hurricane. And I liked what President Obama said today, which is, there's reason for concern, but there's no reason to panic. And I would say that was definitely no reason.
But let's go back to avian flu.
Right.
I think it was overblown, especially several years into it, and I agree with your headline. I mean, if you slept with chickens, you have to worry about avian flu. Those were the people that got it. But otherwise, I think it was overblown.
Well, there are a lot of unknowns here still. It's a fluid situation, and if you want us to be back tomorrow,
I'm available.
Let us know.
Are you available, Peter?
We'll come back. In the meantime, send your questions to doc@cbs.com. And also on my web health show, which is called cbsdoc.com, you go to www.cbsdoc.com. We're going to be continuing this discussion, and we're going to have other important health topics. So until then, I'm Dr. Jon LaPook, and Dr. Jennifer Ashton and Dr. Peter Gross. I thank you very much for joining me.
Thank
And
you.
Pleasure to be
thank
here,
you
Jon.
all for joining me. And keep sending in those questions. We'll keep looking at them, and tomorrow night we'll try to answer them. And again, thank you very much for joining us. Good night and good health.